I'm also licensed to fly a drone.
Oh, good.
Now you're supposed to have one. If they catch you without one, you can get fined.
Yeah, you look pretty good here. Going on a little bit. Going on out and some questions.
Monday?
No, like I'm gonna wait 10 minutes.
Uh-huh.
Let the message to kick in, but in the meantime,
Okay.
we can answer some questions.
All right, let me. Deborah K, thank you so much for the likes. Good morning, everybody. Welcome to our live. We are here with Dr. Cornejo on his first case of the day. It is Lipo 360, BBL, and a dog ear revision. If you guys have any questions about the procedure, as always, let us know in the comments below. We are live on our YouTube channel where you can see the operation as well, guys. You can find that link in the bio and head on over. Other than that, good morning, welcome. Let us know what questions you have for Dr. Cornejo regarding today's procedure or any questions about plastic surgery.
We're doing a BBL.
A BBL.
Alexa, play something on radio.
How did I know?
That person.
Is that like your everyday music, Doc? Like,
I
is that
don't
what,
say.
is that what you listen to in the
This is
car?
a playlist that I. No, no, no. I don't listen. No. Listen or only.
Only in the OR?
Only, yeah. But
Why?
Santana Radio is the number one playlist I've ever listened to. Or that was well. Used to be today's hits
Uh-huh.
in Pandora back in like in
1995.
2017. No, like in 2017. Like when I started,
Mhm.
I used to listen that a lot. And I remember I used to like it, but now it's just like, I mean, I don't know, it's changed, so
Yeah, yeah, I
today's
know what
hits
you
is
mean.
not the same as it used to be. And so that Santana is the number one. And then 80s disco, 80s
Oh,
music.
yeah, you can't go wrong with the
You
80s for
can't,
sure.
but you can go wrong with Santana, man. I'm telling you.
Santana Radio.
Santana Radio, man. You can never go wrong.
But okay, so what is your everyday music choice though? Like, what do you listen to in the car?
Honestly, a little bit of everything. I like a lot of music.
A lot of music,
Sometimes I get into like
different moods,
different moods, yeah,
vibes.
like different weeks, and then I
Yeah.
get tired of listening. Like recently, I was listening to Christian Nodal.
Oh,
Christian Nodal, a
oh
lot.
yes, yes.
Pero pura música deprimente y pura depresión y pura, ¿no? Y dije, you know what, this music is messing me up.
Yeah.
I listen to every day, you know.
You're like, why am I sad right now?
I'm not even, yeah, like, I'm not even heartbroken, you know. Like, but if I was, I would listen to it.
Yeah.
But,
Man.
I listen to, you know, Spanish, English,
But like, okay, so Spanish. But is it like for me, for example, I can go from EDM to country to like rock, and then to like 80s, 90s to freestyle, and then to some Spanish like
yeah,
artists.
no, me too. Like, Jarabe Palo, you know,
Yeah.
like, it's just like different, you know, depends on what you're doing.
Yeah,
I mean,
that's true. Yeah, I mean, really, it does though. That's really what it takes. Is it's your
but
mood.
I listen to a lot of like playlists. I don't listen to one particular
Artist.
artist. Like,
Yeah. That's why I like Spotify, because Spotify does that for you.
yeah, I use Spotify a
Uh-huh.
lot. So it's just like so. But I like a lot of Spanish rock,
Mm-hmm.
you know, Spanish. Yeah, Spanish rock.
Yeah, Spanish is always good.
Yeah, I love 80s music. I love 70s rock.
Yeah. Yeah.
So,
It's all
you
good
know, I mean,
genres.
there's a few things I don't like that and I don't listen to them about.
Isabel, hola, buenos dias. Where's everybody else? We had a question here. I saw it. Oh. Talk to me about those Bridget devices for suture lines. Good, bad for brachioplasty? I'm not too
Which
sure.
devices?
The Bridget lines or Bridget devices? Yeah, Bridget devices for suture lines.
Uh-huh.
It says good, bad for brachioplasty.
Bridget with glasses.
Mm-hmm.
I don't know what's like negative pressure. Bridget.
Bridge,
Bridge?
Bridget.
like
Bridget?
probably like there's like a closing device that you put on both sides,
Right?
and then you tighten it and it closes. Like I forget what brand it is.
Yeah, I remember that one. That's what I thought. But no, we don't use them for brachioplasties, okay? Those devices are used sometimes to close wounds under tension.
Mm.
But you should never be under that much tension in a brachioplasty to use it. That has more usefulness like in lower extremity wounds, where the skin is really tight, like in the ankle or the leg. I've used it, but for brachios, it's not needed. So now we're just gonna break the fat.
Yeah.
Should look more like it.
1 second. Big Boss Garcia, hi, good morning. Welcome to our live. We are here with Dr. Cornejo on his first case of the day. It is Lipo 360 and BBL. If you have any questions about the procedure, as always, let us know in the comments below. We're also live on our YouTube channel where you can see the operation if you want to check that out. As always, feel free to do so. And let us know what questions you have regarding today's procedure or any questions about plastic surgery. Doc, so I learned something new yesterday for doctors or students trying to get into med school. And it's called Match Day. That I learned something yesterday about called Match Day. So, and what I was told was very interesting, and I want to get with all of you guys and do a video telling us your experience on how was Match Day for you.
Yeah, it's a big deal, man, for med school. When you're applying for residency and stuff.
Yeah.
Yeah.
Hold on. Take a breath. Tiffany's asking, how do you guys handle pain management after surgery?
Okay, great question. So actually, a good way to think about that is what we do before, during, and after the surgery. Okay? So before your surgery, there's things that you can do that you can take before your surgery that are gonna help you with pain. Some people take some. I don't want to get into the medications, but there's things that you can take that will kind of like that you take like right before your surgery that will help you. Um, now, during the surgery, we use Expro.
Huh?
It's a numbing medication. Patient is using for 3 days, and that is one of the most important things. Okay, so numbing medication during surgery. Expro stays 3 days. Any other numbing medication stays just a couple hours. Okay, and then after surgery, um, we give you pain medication. There's different kinds of pain medication that you can take, but normally with that, patients tolerate, they're not in excruciating pain. There's a little bit of pain, of course, but they shouldn't be in excruciating pain. That's a very common concern, and I tell them that the vast majority of patients typically do well by following these measures. Okay, so now we're gonna start taking the fat.
Okay. And then Nasrullah Ben Amar, thank you so much for that tip. I'll definitely use that, and then we will be posting once we have videos from all of our doctors, so you can go ahead and see that. But awesome, thank you so much for that tip. Do y'all do payment plans? Neva Backup, yes, we actually do. So with that great question, let me go ahead and follow up with this. Guys, here is our contact form for anybody who wants to schedule a consultation with Dr. Cornejo. What is going on?
But Hernandez, what's do you think this, in your experience before surgery, anything that helps in particular, like gabapentin? I know some people take like, gabapentin. Some people prescribe like gabapentin or NSAIDs before surgery.
Well, one of the latest news in terms of preemptive care not only has to do with pharmaceuticals, but just lifestyle changes.
That's very important thing.
Just the basics of getting exercise, watching your nutrition, hydrating. These things are it seems to be obvious, but a lot of people don't take care of themselves as well as they should. And when you are active preoperatively, engaging your muscles, aerobic activity, your recovery is so much easier and better because your body is accustomed to wanting to rebound, the muscle memory, all of these things added together along with the pharmaceuticals and the other devices that the surgeons use really makes a difference in your recovery. Rather than being sedentary, not doing anything, having a poor diet, not being hydrated. So the simple things that emphasize can certainly help at no real cost.
Yeah. That's actually very important. Very, very important. And so it's not only like just prescribing pain medication, just doing a little bit of everything.
What do you guys do if someone has anxiety?
Anxiety?
Mm-hmm.
Well, it has to be controlled, anxiety is very common, so if it's it's a spectrum, so if patients have anxiety, then we need to address it. And it's kind of important because sometimes surgery can be triggering,
Preoperative education is also very important.
Oh, that's
An
good.
informed patient is a smart patient.
Yes.
And a lot of those fears can be allayed by just understanding the process.
So then, for our patient would be just be informed.
Exactly. Ask questions.
And this is something you would want to do at your consult or a pre-op.
Yes.
Right?
That's a very important. Fernandez says, like, sometimes not knowing it's what's anxiety, like not knowing what to expect. But once you make sure the the patient understands what's gonna happen, what she's gonna go through, that takes away a lot of the anxiety most of the time.
And good morning, everybody. Good morning. Welcome to our live. Happy Thursday. We are here with Dr. Cornejo with his first case of the day. It is Lipo 360 of BBL. Okay, guys, we've officially rolled out with our promotions, our specials for the month of April. You can find those pinned at the top of the profile. Fill the form out. Schedule your consultation. You can even do a virtual consultation with Dr. Cornejo if you're from out of town, or if you can make it here into our office. You can also save on your consultation costs if you do fill out the form while you're here on our live. Hello from Thailand. Nice.
Thailand. I'm ready for dinner.
Doug, how many would you say? I mean, I'm sure you've lost count, right? But a viewer here is asking, how many BBLs and Lipo 360s have you done?
Wow. I mean, in the hundreds, I would say. A couple hundred maybe.
Mm. And then Lobita Joaquin says, buenos días a mi doctor favorito. Los saludo desde Guadalajara, México, comiendo bitotes salados.
He's one of our star patients. Gracias, saludos.
Yasmira, thank you so much for the follow. Welcome to our live. Thank you so much for that. I wish you happiness in your work. Awesome. Big Boss Garcia, thank you so much for the follow. Danny Sue, hi, howdy, good morning. Just a reminder, guys, we are live on our YouTube channel where you can see the operation. If you want to take a look at that, you can. You can find a link in the bio, and you can head on over. Again, it is a Lipo 360 with a BBL. Doxy's mom, thank you so much for the follow. Welcome to our live. Why is there... He's cracking me up. Karen Felix, hola, buenos días. Bienvenida a nuestro live. Good afternoon. Welcome to our live. Iram, buenos días. I'm Jillian from England. Nice to meet you. Nice to meet you, Jillian. Welcome to our live. Good morning from Dallas. Good morning, Dennis. Good morning from California.
Good morning. Good morning.
Awesome, awesome, guys. Welcome to our live. We are here with Dr. Cornejo on his first case of the day. It is a Lipo 360 and a BBL. Medina de Oklahoma. Good morning, buenos días. Mira, saludos al doctor Conejo, mi doctor. So nice.
Gracias, gracias.
Blog. No. Nosotros estamos localizados en San Antonio, Texas. Ah, ok. Medina dice, dile al doctor que nos miramos en mayo.
Perfecto, nos vemos.
Gabriela, thank you so much for the follow. Dami, thank you so much for the follow. Karen, get in, whatever. Um, okay. Bless you. Bless you.
Thank you.
Karen Felix, ojalá nos den Karen Felix, si está interesada en hacer una consulta con el doctor Cornejo, puede llenar la forma y alguien de nuestro equipo se pondrá en contacto con usted.
Yeah, we're almost done with this part.
Okay. All right, guys, so we are going to take a quick little break and we will be right back. We'll be back for part 2.